Senator Siri Carney.
Thank you, Lusky Hurlock. Good morning, Minister, and you're very welcome. Thank you. It is very pleasant to see a Minister from the Department of Health responding to a health matter. I'm very grateful for that. Minister, we're what here since June 2020. In the December of 2019, the then Minister for Health, Simon Harris, and the then Fine Gael TD for Dublin South Central, former Minister Catherine Byrne, both announced the launch of the commitment to the Drimnagh Primary Care Centre at the Mother Macaulay site in Drimnagh, and gave great promises of what was going to be involved in that. They gave a timeline of appointment of a design team the following year, and that by 2021 we'd have, a shovel in the ground, and we would see the actual construction of the site. I appreciate that COVID came in the way of that. I really do, and I'm very, very mindful of that. However, I wrote to Minister Stephen Donnelly it was something like September or in July 2020, just to say, is this progressing? Because the design team is something, you can go out to tender with that. There's no physical meetings on it as such. I received a reply in September, and within that it used the very chilling phrase of it is a dynamic process, which tells me that this is going to stretch on forever and ever and ever. And the community of Drimnagh have been waiting for this primary care centre for an awful long time. It was an overdue announcement when it was made in 2019, let alone that we are now in 2023. I had a commencement on it on the 8th of February 21, on the 29th of June 21. At that time I was told that the design team tender process was underway. Since then I have heard from councillors in the HSE, in their contact with the HSE, that there is a design team were appointed. So I suppose I'm looking for an update on that. If that being the case, and that being at the very least last year, are we going to see significant construction progress in this year? Because I suppose there are a few things going on. First of all, the plans for that is to rebuild an Alzheimer's unit at that Mother Macaulay Centre site, to have a community creche and centre, and then a state-of-the-art primary care centre. We have residents in Drimnagh relying on services that are depleting all of the time. And one example of that would be the CDNT service within the Armagh Road. It is at all-time low levels of staffing, which is really quite frightening. So I don't know, I recognise the challenge of recruitment, but maybe part of recruitment is offering people a fantastic facility to work in that has state-of-the-art facilities that goes with these primary care centres. And I've seen great successes in them. The one in Rialto is great. We have others across the constituency, but this one in particular, it's really long overdue, and it is a real, I suppose maybe it's a symbol to the people of Drimnagh, and particularly to the group Dynamic Drimnagh, that brings together all of the organisations and the communities and that are mobilising for that village of Drimnagh that is long overdue and needs to be part of the construction planning there. But that community looks at increased numbers of apartments being built, their population going up, and still no guarantee that they're going to have the healthcare services and the primary care centre. So this is symbolic of the way forward for the community of Drimnagh. It's symbolic of, if we have the primary care centre, then that is a symbol, a absolutely tangible experience of the commitment of government to the people of Drimnagh. And then we are building community and village and more in a tangible way around that in the fantastic plans that they have. So I'm keen to hear, where are we at as of today?
Thank you, Senator Carney. Minister.
Thank you, Lusky Hurlock. I would like to thank the Senator on behalf of Minister Donnelly for providing the opportunity to update the House on Drimnagh Primary Care Centre. A central objective of the programme for government is to deliver increased levels of integrated healthcare, with service delivery reorientated towards general practice, primary care and community-based services to enable a home-first approach. Primary care centres play an essential role in the delivery of the objectives, and significant progress has been made in the delivery of these centres nationally. These centres support the delivery of integrated care by facilitating closer coordination and cooperation between health professionals across different disciplines. They also provide a single point of access to services for the individual and can serve more broadly as a resource for the community. Senator, there are currently 165 primary care centres operational, with 14 more currently under construction, and 12 of these are scheduled to be delivered over the course of 2023. We have seen absolutely huge investment in primary care centres throughout the country over the last 10 years. I suppose a new departure, and they have been really welcomed by the various communities. In response to your question, though, the Drimnagh Primary Care Centre will be located on the existing site at Curlew Road. It will provide vital services in CHO7 and specifically in the South Dublin suburb of Drimnagh. Funding was allocated in Capital Programme 2022 to commence the design process for Drimnagh Primary Care Centre. A design team has been appointed and the preliminary design process is underway. The local service are reviewing accommodation requirements to ensure the building will accommodate the services and primary care teams required to deliver the healthcare needs to the Drimnagh area. Capital approval has been granted to complete a strategic assessment report for Drimnagh Primary Care Centre. A consultant is currently being appointed to complete this SAR. The Primary Care Centre in Drimnagh is envisaged to facilitate a primary care team, including addiction and older person services, older persons daycare services, alongside public health and community nursing, physiotherapy, occupational therapy, speech and language therapy, dietetics and counselling. It will also consist of the following services: 3 general practitioner suites, which are very important because we've seen GPs move into primary care centres, and it's nearly a one-stop shop now for people when they have to have a lot of other issues identified. A daycare centre for persons with Alzheimer's illness. That's something very close to my own heart. To date now we have 40 daycare centres for Alzheimer's specific opened, and we have a great working relationship with the Alzheimer's Society of Ireland. I suppose one thing we discovered during COVID was, in relation to infection prevention and control, that some of the premises that we were providing services on for daycare and for daycare dementia specific, that they probably weren't fit for purpose from an infection prevention and control measures. And we spent a lot of time and money during COVID making sure these services were fit for purpose. But we do need them everywhere, and I just think it would be absolutely fantastic to see a specific daycare centre for people with Alzheimer's. 11 people are diagnosed with Alzheimer's every day of the week. We currently have 64,000 people in the country with a dementia diagnosis, but we probably have as many without that diagnosis. And then also a community centre, including a creche, which would be great too. So these services will be integrated with the proposed on-site GP service and provide an integrated service to the public all under one roof. As you know, Senator, all capital development proposals must progress through a number of approval stages in line with the Public Spending Code, including detailed appraisal, planning, design and procurement before funding for each stage can be confirmed. But I do know, having listened to Minister Donnelly after having so many meetings with him, he is frustrated with the slow pace of this, of the appraisal, the planning, the design, the procurement, and he is hoping to expedite that across all capital spend for health services.
Minister, Senator Siri Carney.
Thank you, Carrick. Minister, thank you very much. I mean, you paint a fabulous picture of what the Drimnagh Primary Care Centre is going to look like, and it will have incredibly valuable services. My problem with the whole thing is there's no dates on it. And the day when a resident of Drimnagh walks through that primary care centre could be 10 years away, for all I know. And that piece of it, words like preliminary reports, strategic assessment reports, how long do they take? What is their purpose, I say, as someone not really understanding what that is. But presumably it's necessary. But is it a report and a report to be followed by another report, a report on that report, and then we still have no primary care centre when it is desperately needed for the people here? And I suppose that's my concern. My concern is we need to start seeing timelines, and we need accountability to those timelines. And I appreciate that's not necessarily always within the Minister's gift, but it is in the Minister's gift to drive it and demand accountability from design teams and from the process.
Thank you, Senator. Minister.
If I could just reiterate, Senator, like we have seen the huge expansion of primary care services, primary care centres over the last 10 years. We have 165 now, as I said, 14 currently under construction, and 12 of these are scheduled to be delivered in 2023. But unfortunately, your one isn't included there, and there's one close to my own heart down in Waterford that I'm trying to push as well. But in general, you know, I suppose the precedent is there. Every year, whether it's like the community nursing units, the HSE-run community nursing units, we announced 7 of them in December. The rollout will continue because there's a strategic plan there to deliver these. I know it's frustrating when you don't have clear guidelines, but at the same time, you're on the capital plan. Funding was provided in 2022. We haven't seen the capital plan for 2023 yet, but the most important thing I always find that you're there on the capital plan, you're on Appendix 2, you'll move up to Appendix 1, but we are frustrated in the department that the amount of time it takes for any capital investment building. I think a lot of time is lost in the preliminary years. I know a lot of scoping has to be done when you're at design stage and you're planning, but I don't see why both can't run in parallel with each other. And it's probably something I'm quite frustrated about myself in relation to mental health in older people, and something that Minister Donnelly has put a focus on at the moment. Thank you.
And just to acknowledge the phenomenal work that Senator Siri Carney does for the people of Drimnagh in this House week in, week out. Thank you, Minister.